Hi, I'm Dr. Michael Ryan, orthopedic surgeon with Andrews Sports Medicine and Orthopedic Center. I grew up in Colorado Springs, Colorado. I grew up primarily playing ice hockey, but I also played a lot of football, tennis, golf, and I skied quite a bit. And that was, essentially what led me into the idea of wanting to be able to be involved with athletes throughout my career. I always grew up loving science, even from early on in 5th grade. I remember dissections were one of my favorite things. And it was really in early high school that I was able to marry my love of athletics and my love of science with orthopedic surgery after I started to see some friends who had undergone some orthopedic surgeries and come back to play sports and were able to return to their full athletic function and abilities after undergoing surgery. After graduating high school, I matriculated to University of Notre Dame in South Bend, Indiana, where I had an amazing 4 years, and my love of college football grew. And then after that, I was fortunate enough to go to Georgetown University in Washington, D.C. for medical school. And then I completed residency in New York at NYU Hospital for Joint Diseases for 5 years, and then came to Birmingham, Alabama, where I had the opportunity to train with some of the world's best sports medicine surgeons. They really exemplify what it is to operate at a very highly skilled level, to provide excellent patient care, exceptional patient outcomes, and provide really advanced research in the field of orthopedics and sports medicine. I personally have gravitated towards taking care of the hip. Later on in my residency, I developed an appreciation for hip impingement, hip preservation, and through that I completed a 3-month fellowship in Switzerland, which augmented my experience here at ASMI to allow me to take care of young adults with hip pathology, and with the idea that if we can take care of their problems and affect change early on in the process, we can not only allow them to return to function at an earlier level, but also preserve the hip for a longer period of time throughout their careers. With respect to the shoulder, that would include shoulder instability surgery, so labral repairs, rotator problems, rotator repairs. With respect to the knee, very commonly we hear about ACL tears, so I would be involved with ACL reconstructions, patellar instability where the kneecap moves out of place, so trying to fix that. And then with respect to the hip, it's what we call hip impingement, where the ball and socket of the hip has some abnormalities in its structure, which causes labral tears. It can cause pain in the hip with certain athletic activities. And so my goal is to be able to address that as well, whether it's through arthroscopic surgery or open surgery, which would include an osteotomy or a surgical hip dislocation. I don't play as many team sports anymore due to time constraints, but one of my biggest hobbies is triathlon and marathons. I've completed over 15 Olympic distance triathlons, 3 half Ironmans and 1 full Ironman, and several marathons as well. And so, being able to be part of this athletic atmosphere helps me kind of continue that. I've really come to love the culture of Alabama and the people here. It's something that I don't think is really present anywhere else in the country. So my wife, she and I met when I was first a medical student. She keeps me very well grounded, and she's really my better half. She's seen everything we've gone through as residents through the 5 years, and we're both very excited to be here and make a life here in Birmingham. I have so much fun operating. I think it is probably one of the coolest jobs anyone could ever have.